My name is Holly Chapman, co-founder of Community Overdose Response and Recovery Effort, or CORRE, and I'm here to talk to you today about opioid overdose education, harm reduction, and naloxone administration, or OENA. Some of our learning objectives include examining the opioid overdose rates and the overdose crisis, fentanyl and social media drug markets, recognizing signs and symptoms of acute opioid overdose, and describing the role of naloxone in opioid overdose reversal and prevention. So, who does the overdose crisis impact? It's just about everyone. From elderly individuals who need to manage long-term pain, from normal individuals who are looking for medications that are a little bit cheaper and that may contain opioids such as fentanyl, and even infants who may be diagnosed with neonatal opioid withdrawal syndrome, or NOWS, because their mothers have been taking opioids while they were in the womb. So in 2022, fentanyl was listed as a leading cause of death in adults ages 18 to 45. This is over suicide, car accidents, and even gun homicide, which are usually those top three. So fentanyl is a synthetic opioid that is 50 to 100 times more potent than prescription opioids, which are pain medications. And from April 2021 to 2023, there were about 221,000 reported overdoses in the US. So why opioids? Well, general opioid uses include medical usage such as surgery, oncology or cancer, pain, diarrhea, and just cough. Illicit uses include euphoria, stress relief, and just self-medication in general. Opioid overdose, they attach to receptors that control breathing. Oxygen then can't get to the brain, and you decrease consciousness. It can lead to a coma and then death. Drug overdoses, specifically those containing opioids such as fentanyl, continue to increase. So around 2012, the Federal Drug Administration tried to regulate prescription opioids because they thought, hey, maybe curbing those prescription opioids could be the solution. So as the number of prescription opioids went down from 2012 to 2021, kind of the opposite happened. The number of overdoses involving opioids really greatly increased. So we really can't regulate our way out of this problem. So what do? People are turning from prescription opioids when they can't manage their pain, or for other reasons that I listed a minute ago, to illicit sources. So these illicit sources include fentanyl adulteration and the social media drug markets. So counterfeit drugs are everywhere. But right now, some of the issues are that counterfeit drugs, people aren't even looking for fentanyl. They're not looking for opioids, and it's just happening to be in it. In 2024, the DEA seized over 208 million pills that contained fentanyl. 7 out of every 10 illegally manufactured pills and illicit powders seized by the DEA contain a lethal dose of fentanyl. These pills and powders are mainly adulterated or spiked with fentanyl, as the individuals may have been seeking other drugs or pharmaceuticals. Anything ranging from counterfeit Xanax, Adderall, cocaine, even marijuana have been shown to contain potentially lethal doses of fentanyl. A lethal dose is around 2 milligrams, or just a few little crystals like you would see table salt. Obtaining illicit drugs and counterfeit pills are at an all-time high due to the convenience of social media drug marketing. Platforms like Instagram, Snapchat, X, and Facebook all have dealer accounts. You find one of these accounts or these handles, and they send you an entire menu of illicit drugs that they can sell. You can order them as easily as sending an emoji. The entire process is contactless. The dealer can receive online payments through things like Cash App or Zelle or PayPal and just drop it off at a predetermined location. Fentanyl is really being found in a majority of these street drugs. So you really want to be careful where you're getting your medications from. How can we prevent opioid overdose deaths? Well, again, opioid overdose is a result of what's called respiratory depression. So your brain and body are full of receptors that recognize and respond to opioids. When too many opioids flood the brain's receptors, that they then trigger your body to stop breathing. If not treated immediately, you have a lack of oxygen that can lead to unconsciousness, coma, and then death by hypoxia or oxygen not getting to the brain. Some overdose signs and symptoms include unconsciousness or unresponsiveness that can be tested by what's called a sternal rub. We'll talk about this later, but it's basically your knuckles pressing directly on the sternum. This is a painful process that would rouse someone that's just passed out. Things such as blue lips or fingernails from cyanosis or lack of oxygen, and things like shallow or slowed breathing are things you want to look for when you have or suspect an opioid overdose. Typically prescribed opioids, such as like OxyContin, Percocet, Vicodin, and heroin, overdose can occur within 1 to 3 hours after they've taken whatever it is. Fentanyl, a synthetic opioid, which we said was 50 to 100 times more potent than other opioids, this overdose can occur in as little as 1 to 3 minutes. 1 to 3 minutes. The person has been reported to have a prompt stiffening of the body. They'll have a rigid chest. It may look like a mini seizure at first. The muscles in their chest or their intercostal muscles really tighten up, and it causes what's called a wooden chest syndrome. Individuals have reported immediate cyanosis or those blue lips, abrupt respiratory arrest or the stoppage of their breathing, and like I said, seizure-like activity. So just a few fentanyl facts to drop here. Fentanyl enters the body through the bloodstream and through what is called mucosa, which is your eyes, your ears, your nose, your mouth, and one other one we don't talk about in public. The myth that we really need to debunk here is that purely touching fentanyl cannot cause an overdose. It needs to enter the body and bloodstream through those sources I just said, the mucosa, eyes, ears, nose, mouth. You can't overdose by just touching it. So one medication that can reverse the effect of opioid overdose is called naloxone or Narcan. This is absorbed typically through nasal mucosa. It reverses that respiratory depression because it's kicking those opioids off the receptors. It's going to last around 30 to 90 minutes. It can neither be abused nor cause overdose. It can cause withdrawal, but it cannot be abused nor cause overdose because it has no other action in the body besides kicking off those opioid receptors. It is available as a nasal spray and an injection, which this nasal spray is now listed over the counter, which is fantastic. It's about $42-ish in Texas over the counter, but there are community sources that you can get these things for free. So opioid overdose reversal, I mentioned earlier, there's a bunch of opioid receptors in your body and your brain. When those receptors are flooded in your brain, that can cause you to stop breathing. The area is called the pre-Botsinger's complex. When that gets flooded with opioids on their receptors, you will stop breathing. Naloxone goes in the nasal spray, it goes straight through your nose. It is absorbed directly into the brain. It starts working in 1 to 3 minutes. It's kicking those opioids off, and it does not require prescription. Available over the counter, as long as you keep it in a cool, dry place, it can be effective maybe up to 30 years. If paired with what we call rescue breathing, which is 1 breath every 5 seconds, you can effectively prevent opioid overdose death and give that person a second chance at life. So we have something called the Opioid Overdose Prevention Action Plan. So these are just about 7 steps to reverse overdose once you figure out that somebody has overdosed from opioids. So the signs and symptoms that we're looking for, we have our unconsciousness. You are not able to rouse this person. The way you test to rouse this person is with what we call the sternal rub. A sternal rub is putting your knuckles up in an open fist like this, putting it directly on the breastbone or the sternum, and really digging in. This is very painful. If the person is just unconscious, they'll most likely wake up with this painful process. But if you can't rouse the person with this, and you also see that they're not breathing and they also may or may not have blue lips, you want to call 911 immediately. If there's no response, you want to start this process, call 911 immediately, because you always want to have external care coming, because even if you reverse the overdose now, those opioids are still in their system and could actually re-overdose later, because naloxone only works for 30 to 90 minutes. So even if you administer that first dose of naloxone, it's only lasting 30 to 90 minutes, they could re-overdose after that time. So you always want to call emergency services to give them external care after you provide these steps. So you've called 911, you administer the first dose of naloxone. If you have the nasal spray, just take it out of the package, put it in the nose, press the plunger. That's all you need to do. So you've administered the first dose of naloxone. They don't have to be breathing because you just checked for their breathing. So it's just going to absorb in and it's going to start working in 1 to 3 minutes. Well, in that 1 to 3 minutes, you want to wait before you give them the second dose, because usually the boxes of naloxone will have 2 doses in them. You want to start rescue breathing immediately. They're not breathing. So rescue breathing, you're going to lay somebody out on their back. You're going to tilt their chin up. You're going to plug their nose and give them 2 quick breaths. If their stomach rises, you may want to adjust the angle so that you're actually getting it through to the lungs. If their chest rises, you're good to go. You're going to give them 1 breath every 5 seconds, and that's going to be about 2 to 3 minutes before you give another dose. If nothing rises at all, you may want to check to see if there's an obstruction inside the airway. So if they're not responding after 2 to 3 minutes of rescue breathing, so 1 breath every 5 seconds, give that second dose of naloxone. Again, they're not breathing. It's just going to be absorbed directly through the nasal mucosa. You just take it out of the package, stick it in the nostril, press the plunger. That is it. Okay, so if they're still not breathing after that second dose, which starts working in 1 to 3 minutes, continue rescue breathing until the person responds or EMS or emergency services arrive. If their breathing is restored, you want to place the person in what we call the recovery position or the left lateral recumbent position. You want to lay them on this side because naloxone can cause withdrawal, and withdrawal comes with things like nausea and vomiting. So you want to make sure that this person isn't going to, if they vomit, they're not going to breathe that back in, or what they call aspirate. So you want to lay them on their left side and just kind of prop them up so where they stay on their left side until they're ready to kind of get up and rouse themselves. So that's it. You look for the signs and symptoms, which is unconsciousness. You can't rouse the person. They're not breathing, and they may have blue lips and blue fingernails. You're going to use your sternal rub to see if they can wake up. If they don't, immediately call 911. They need further care. So then you administer the first dose of naloxone. Take it out of the package. It's a nasal spray. You put it in the nose, press the plunger. That is it. You start rescue breathing, 1 breath every 5 seconds, laying them out on their back, tilting their chin back, plugging the nose, 2 quick breaths. If their chest rises, you are good to go. 1 breath every 5 seconds. If no response after 2 to 3 minutes of this rescue breathing, give the second dose of naloxone. Doesn't have to be in the same nostril. Just give it to them. You cannot give them too much naloxone out of the dosages that they give you in those packages. Naloxone cannot be abused because it does nothing in the body other than kicking opioids off of their receptors. So you continue that rescue breathing, 1 breath every 5 seconds until EMS arrives or the person responds. If they do start breathing, help them into the recovery position or the left lateral recumbent position. You're just propping them up on their left side, so in case they throw up, they're not going to breathe that back in. And then that's it. Hopefully you've saved a life. If you have any additional questions about opioid reversal, or you need to just know some more about why this process is done, you can contact us at correapp.info@gmail.com. That's CORREAPP.info@gmail.com. Thank you for making it to the end of this video. We really appreciate you watching this. If you want more content like this, we'll have some links below. And we also have a short survey, 2 to 3 questions for educational purposes to see if this was useful to you and what other content you'd want to see. Thank you.